Honorable Member for Laborie.
Thank you very much, Mr. Speaker. Mr. Speaker, we on this side of the House have always supported measures to improve quality health care and affordable health care for the people of this country. And we welcome support from the International Development Association for capital expenditure for the health system strengthening project. However, Mr. Speaker, I listen to words and empty words from members opposite regarding their commitment to health care in this country and to provide people with a health facility so that they can access quality health care. But you must first have the facilities in place, Mr. Speaker, for the people to access quality health care. I want to, of course, accentuate the fact that unlike the Labour Party when it entered office in 2011, that found a scope of works with no monies, when we left office in 2016, we left monies for the St. Jude's Hospital, for example, to be completed. And this government has decided to stop the reconstruction project and come here and talk about commitment to health care. Mr. Speaker, this is not a joke. In an environment where countries are not as generous as before, we got tremendous support for us to deal with St. Jude's. We got a grant from the Republic of China, Taiwan of $22.5 million. Grant funding from the government of Australia, over $1 million. Grant from the government of Mexico, which I negotiated in 2013, of over $7 million. Yeah, you can accentuate a mug, but it's a necessary aspect of the operations of a hospital. We got grants from the government of Germany, over $2 million. From the government of Israel, we got over $40,000. Grant from the Republic of India of over $672,000. Donation in medical equipment from HES, $2.7 million. Donation medical equipment from the United States of America, $2.7 million. Total cash overseas persons and organizations, over $2 million. Mr. Speaker, I have said in this House before that on June 6, 2016, when the United Workers' Party unfortunately found themselves in the corridors of power, they found 2 buildings that were yet to be completed. The West Wing, the East Wing, and the surgical building. All they had to do, Mr. Speaker, was to tile the floor, put the tiles in the roof, connect the electricity, and go to chemical, Mr. Rosary, get some chemical and clean the building and move the people to the hospital. But no, they must engage in some long dance. Promenade hours. Stop the hospital. And today, it's an eyesore. It's a breeding ground for rodents. So we have no St. Jude's Hospital. A hospital that could have been completed by the ending of 2016. It's not there. They have left the buildings to deteriorate. And rats are having convention there on a daily basis. And of course, with the incidence of leptospirosis, Mr. Speaker, there is no St. Jude's Hospital to deal with the impact. I know they laugh because people die and they don't care. They don't care. When people die on dialysis, to hear the kind of comments that they make. I spoke about an old lady from Auger who died on her way up to Tapion. But that's of no consequence to members opposite. Of no consequence whatsoever. And whilst we welcome any support to improve the situation, $20 million will not resolve the health issues in this country. And we know that the importance of hospitals and health centers. We know the importance of that. If somebody, doesn't matter how much money you have, how much health insurance you have, and you fall sick in a part of the island that you cannot access quality health care, at least to stabilize the patient before that patient could be moved to Tapion or that patient could be moved overseas. It's like you having $1 million in a desert and you cannot buy water or food. So what is this government talking about? Their commitment to quality health care. When the Labour Party was in office between 1997 and 2006, we demonstrated a clear commitment to providing quality health care for the people of this country. That's why we refurbish health centers all around the island, built health centers, to ensure that we strengthen our primary healthcare system. Because a number of the problems that we have to deal with at the major hospitals, like cerebrovascular accidents, if you can just manage hypertension and those other diseases at the health center level, everything will create a better framework for people to live longer. And in our quest to introduce universal health care, we were providing free screening for persons with diabetes and, of course, hypertension, and providing free medication. The mechanism was already in place for us to introduce universal health care. Everything was in place to introduce universal health care. In fact, Mr. Speaker, when we decided to improve the facilities in this country, it was out of that vision that the new national hospital, the OKEU hospital, was conceived. And they even amputated one of the fingers. And today it's inadequate. And I heard the Prime Minister in his opening remarks spoke about the number of beds. They do not have sufficient number of beds. It's because you all amputated one of the fingers at the hospital for no good reason. For no good reason. In fact, we were so advanced that a World Bank report, A Time to Choose Caribbean Development in the 21st Century, it was an April 12, 2005 report. And if you look on page 116, among a few countries that had decided to provide improved services, St. Lucia was one of them. To produce spa wellness and a healthy lifestyle, St. Lucia, yes. Alternative and complementary medicine, medical treatment, St. Lucia was right there. Elective surgery, oncology, cardiology, plastic surgery, eye surgery, renal dialysis, recuperation and recovery, and many other areas, Mr. Speaker. It meant that St. Lucia recognized the need to establish a very good health sector in St. Lucia to provide for our citizens as well as the many tourists who come from overseas. In fact, Mr. Speaker, the Labour Party is well aware of the fact that today people live much longer than before. And research has indicated quite clearly that there is increased disposable income among the elderly in North America and Europe. And among the things that they would do is to make a more effective demand for goods and services, including air travel. Therefore, as you have elderly people coming here, you need to have a healthcare system in the country that could provide for them in case of an emergency. As people live longer, the possibility of a heart problem, hypertension, diabetes would be very, very likely. And so we put those mechanisms in place to ensure that St. Lucia is able to improve the quality of healthcare in this country and to provide for its people, including universal healthcare. So when members opposite come to this house and pretend as if everything is okay, that $20 million will solve the problem of everybody in this country, that is not true. This is not true. You need to complete St. Jude's Hospital. We have a CT scan that we cannot use. It's in one of the rooms at the hospital. We cannot use the CT scan. And for no good reason, you just abandon the project. We have monies. We borrowed $20 million from the Taiwanese. We have only used a portion of it. No mention of that. Hey, but you come here to borrow another $20 million US dollars. Why don't you finish St. Jude's? And have the staff and the patients at St. Jude's to enter there. Just recently I had an experience. I went to St. Jude's for 2 weeks every day, attending to a loved one. And I saw the conditions there. And every time I went there and I saw people and how they complain about the inconveniences. And, you know, instead of doing works at St. Jude's, they are there on some containers doing... Mr. Speaker, I have said before, and I'm going to say it again. You see St. Jude's Hospital? It is not for sale, and it is not for occupation by any other group of people apart from the doctors, the nurses, the other staff at St. Jude's, and the patients. You cannot be talking about commitment to quality health care where you have abandoned a hospital project and it's now just a playground for rats. A playground. And the buildings are there. Every day I pass up and down this road and see this situation. You know, it breaks my heart. It breaks my heart, but they're on the other side, they talk about empathy, and look at the way they behave. This is what you call organized irresponsibility, you know, Mr. Speaker. By just abandoning the hospital and playing games with the OKEU hospital. That's organized irresponsibility. And the Prime Minister must get down to business and complete St. Jude's Hospital. Yes, complete it. I represent the people of Laborie Auger. Always. This is why I obtained more than $7 million to assist the Prime Minister and the Minister of Health at the time in completing that facility for the people of the South in particular and St. Lucians in general. Every time I speak about St. Jude's, you know, some of your operatives just go on Facebook and talk about St. Jude's material. You understand?
Yeah, Devon Nick.
Yes, some Devon Nick just today.
The guy at customs?
Yeah, I don't know where he's from, but I'll tell you something, Mr. Speaker.
He's in the garage.
Anybody who did anything wrong at St. Jude's must be prosecuted. Must be prosecuted. And you know, sometimes you're in politics and people believe that because you're in politics, you're some kind of a mat. I'll tell you this. You see, banks are available for people to go for loans. The Laborie Cooperative Credit Union, the key to our economic salvation in the PRL, they are available to provide loans, for people. And I am from a family that have always done things lawfully and together. And you know, it's so disrespectful that because you're in politics, you must do nothing. You go to the bank now, it's corruption. You know, you sit down and collectively with your siblings, you do something. It's corruption because you take a loan from a bank and you take loans to renovate a facility. All my life, even as an air traffic control officer, I bought my first vehicle. I bought my second vehicle. I bought my third vehicle. I bought my fourth vehicle. I was nowhere close to politics when I bought my house. I bought a 3-bedroom house as a young man. And I was nowhere close to government when I bought the vehicle that I currently own, and the only vehicle that I own. And if I wanted to maximize profits, I would go into business. I won't come into politics. But you see, my faith has always been in the God that I serve. And you see those who sit on a computer maligning people, one day they'll want to type, bring me a glass of water to save their lives, and they will not be able to do it because they have maligned people too often. And those who go and call and say all sorts of things, they will need that voice to ask for help one day, and they will not be able to get it. This is why I will never go on Facebook and try to malign anybody.
Honorable member.
No, I'm on course. I'm on course. You see, sometimes when you navigate, I am in the realm. I'm in the realm of St. Jude's and medical facilities. And so sometimes when you navigate, Mr. Speaker, and it's just a fact that you have to deviate off course sometimes due to turbulence. And there was a bit of turbulence, so I had to, but I'm now back on track. You call that crabbing back onto the route. But the fact is, I want this House to know, and I want honorable members opposite to do the honorable thing. Don't send your operatives on kind of pseudo names on Facebook and try to attack people. This man have never been involved in any kind of corruption in public funds or anything. Okay? I obtain everything that I have legitimately. I didn't just appear in politics,
Honorable member, get back to the bearing.
Mr. Speaker, when you navigate, you need some latitude sometimes.
I have surely given you that.
And you even and in navigation we have even more than latitude. We have lines of longitude, Mr. Speaker. So sometimes it takes a little bit more time to get back on the center line of the route. But you see, Mr. Speaker, it's important that I made this point. Because when people want to malign you about St. Jude's material, that's a facility we wanted completed in 2016. And when people try to play games, when I come here and I address seriously the business of the people, and they go on Facebook and write their foolishness, I am not moved by that. But I pray to my God at all times that I have the strength to continue that journey to deliver to our people. And it is this Almighty that will put a stop to those who figure out that they have dominion over life and death in this country. In an instant, he'll take away the power. Anytime you're going to use power as a weapon and not as a tool to develop this country. And we must stop playing games. Get down to business with St. Jude's. Because whatever you have up your sleeves, you all are not going to succeed with St. Jude's. St. Jude's will be completed for the people of the South and for the people of St. Lucia. Nothing else. Nothing else. And you cannot justify the delay either. Why? Why for years? We're in the third year. Your third year after general elections. And you all are just, you all are so casual. Just got pomnel hours to patu. Pomnel hours, threaten people and do all sorts of things. But you'll suffer the consequences of Belshazzar. Belshazzar, remember. And the member for Kaswi Southeast can guide you all on Belshazzar.
Serious?
Yes, he will be able to. That's where my grandmother used to go to church. In Kaswi Southeast. She spent a long time there, Sister Fletcher. A long time going to church there. And the values that were instilled in me from that early stage, by being exposed to the Adventist church, I know that they taught you properly. But you're doing your own thing, you're in bad company. You follow in bad company. But Mr. Speaker, just to conclude, Mr. Speaker, just to conclude, I think you all are overreacting, members. Just to conclude. Yes. But sometimes, anyway, Mr. Speaker, the point is, this government is not committed to no health care. And by just packaging statements about, we have to go and take care of our people and we love our people, that does not translate into effective policies. That does not translate into fixing up St. Joe's Hospital and to deal with OKEU Hospital. So that's just words and empty words. Get down to business. We welcome the $20 million, whatever it can do to improve the situation, but without the facilities, you can provide no health care. You cannot provide anything. And so, Mr. Speaker, I ask the government, the Minister for Economic Development, the Minister for Health, the Prime Minister, and others, next cabinet meeting, set the date for the works at St. Joe's Hospital to recommence and to complete that hospital with lightning rapidity. I thank you, Mr. Speaker.